Ciao mondo, hello world, hola mundo, hello monde, konnichiwa, ni hao, namaste. We are here in Hong Kong with a special event, which is the annual meeting of the Hong Kong Society of Nephrology. And I'm fortunate enough we'll be here with Dr. Shun, president of the society, and Dr. Richard Yu, a legend in nephrology in Hong Kong. So, Dr. Shu, what is the meaning of this annual meeting and how is the Hong Kong Society of Nephrology doing?
Yes, actually Hong Kong Nephrology of Society was formed, a Society of Nephrologists was formed in 1979, and we're connecting all the kidney professionals in Hong Kong. And each year we will organize annual scientific meeting, which are important scientific meeting, updating the latest practice and also joining all our members together.
Okay, and the main scope of the society was to become an informative tool for young fellows or for professional or what?
Yes, actually our society connect all the kidney care professionals in Hong Kong, from trainees and also to specialists, and also we welcome student members if they would like to join us. And our aim is to advance the practice of nephrology and to enhance the patient care.
What is special about this year's annual meeting?
This year's annual meeting, actually we are honored to have you, Professor Ronco, with us. It's 100 years of hemodialysis, and we have special sessions on that. And also we also have hot topics with AI in nephrology and also genetic testing in proteinuric disease by ERA President Professor Rosatora.
So thank you very much, and we also have the honor to have Professor Richard Yu with us, a legend in nephrology. Can you tell us a little bit about your pioneering work? I think the Yu family was very important for healthcare in Hong Kong, right?
Well, in 1966, well, I received my training in after I qualified, I was to go to London to do postgraduate medical education. My boss, Dr. Gerald Choi, suggested after he had his sabbatical in London, he came back and reminded me that there's a new specialty being developed in the world, and that is nephrology. And would you like to take up? So I took up nephrology, and my general nephrology training in the University College Hospital under Professor Max Rosenthal. And during that time, there was not even dialysis. It was just clinical nephrology. And there I started to do some research work in the angiotensin II, in the development of hypertension. So I returned to Hong Kong in 1966 and joined the Department of Medicine in the University of Hong Kong. And there I started the nephrology specialty in Hong Kong, where we had the weekly renal biopsy study, and together with Dr. Chan Zhou, we have our weekly sessions, and we have the nephrology outpatient, and subsequently later on, we started to have dialysis. The first machine was the big
A rotating drum probably.
the drum,
Yes.
but it's the Department of Surgery. So we gradually developed initially the dialysis for acute dialysis, and later on transplantation by Dr. in 1969, I had my sabbatical and was in the Royal Melbourne Hospital under Professor Kincaid Smith. And there I learned the dialysis and transplantation. And when I returned to Hong Kong, we continued to establish the dialysis unit and transplantation.
And since there, you're still active. How old are you, if I can ask?
This year I'm 92 years old.
So you are an example for every one of us to show that pioneering work, continuing work, and being continuously updating on innovation is part of the passion of being a nephrologist in the world.
The other passion I have is teaching.
Oh, absolutely. The three columns of our profession, I think, is patient care, research, and teaching. So thank you very much for joining today.
The emphasis of teaching is every year, either in Hong Kong University or Chinese University, I always give the first lecture. The first lecture is titled History Taking.
History taking. Okay.
So my emphasis to all the undergraduate is, in spite of all the advances, clinical medicine is still an art.
And this year I was fortunate enough to be invited to give a talk at your meeting on 100 years for dialysis and receive the Medal of Excellence entitled to Professor Richard Yu. So thank you very much for joining today Cappuccino, or actually Hong Kong coffee from Hong Kong and the Hong Kong Society of Nephrology, and have a wonderful day. We can drink this. Excellent.